Hello, everyone. This is Dr. Janine Cross. Welcome to week one of Social Work and Healthcare, uh, part two. This video is just meant to give you an overview of the course, welcome you to the course, and talk a little bit about social work and healthcare. As you know, or many of you may know, I am a perinatal social worker, or identify as a perinatal social worker. I am also more broadly a medical social worker working in hospital based social work for approximately 15 years. Um, my background is I used to work in direct practice as a medical social worker at the hospital of the University of Pennsylvania for many years. I more directly worked at the newborn intensive care unit was my direct placement, but I also cross cover services throughout the women's health department in the hospital. So that includes OBGYN, gynecology, labor and delivery, perinatal evaluation center, um, maternity, uh, newborn nursery, as well as the newborn intensive care. Um, I am very excited about medical social work and healthcare social work. My goal is to get more social workers involved in healthcare social work. I think it's a rewarding field, plenty of opportunity for growth, and it intersects with so many other issues, as you will get to learn from your readings. So you're not just doing medical work or social work practice, but you're learning to work on interdisciplinary teams. You're also learning about different diagnoses and disorders. You're learning about healthcare from a disease standpoint, from a chronic illness standpoint, from a health system standpoint, payers, systems, policy. You're really getting a comprehensive learning as well as professional practice experience in healthcare, and the opportunities to understand different disciplines and how they look at practice is what you'll get in medical social work. If you review the course in Blackboard, you'll see that we use a lot of different type of options to help educate you this semester as it relates to social work and healthcare. One is your required textbooks, one being Gallagher and Brown textbook. The second one, McCoy and Kirsten edition, fourth book or fourth edition. We also use websites. We also have a lot of upcoming webinars and prior tape webinars that you'll have access to. This is just to keep you abreast of the conversations and professional practice in healthcare that's going on currently. So again, you'll have websites, videos, as well as webinars on top of the required readings. In addition, the monograph 3 from Howard University that is edited by Dr. Gordine and myself. There are key inserts or articles from that monograph that I have uploaded on the website that we'll be looking at because it focuses on a very relevant public health issue, which is COVID-19. And it also gives you the practice wisdom of faculty and even PhD students here at Howard University and insights in the field related to what is being seen in the District of Columbia, Maryland, and other places, and how we're looking at COVID-19 from a healthcare perspective and how it intersects with um, physical health. And I'll talk a little bit more about that. So this week, we're really just giving you an introduction to social work and healthcare from a a micro meso level. It really talks about the history of social work in public health. The origins of social work is public health in many ways, and so the readings talk about that. The readings that you're covering this week also talks about the role of social work. It's very dynamic in healthcare, and the reading selected shows you that. It really talks about the role of social work on healthcare teams in interdisciplinary practice. And one of the readings really give you an example of what it looks like in one particular area of social work, which is experience of a social work working with a family in a newborn intensive care unit. Um, it also talks about, the readings really cover also decision making and what it looks like. A model of decision making in healthcare is presented, um, as well as the case example that was provided, the case study provided the same framework to show you how to apply that framework in social work healthcare. Um, in addition, you'll be learning a lot about social work just broadly from one book, really structures, policies, history, role specific, but also then what does that look like in different areas of social work. The other book provides more specific examples and case studies. And these are all written by medical social workers in the field, in different services in healthcare, talking about experience and what social work looks like. So I'm really excited to really give you a bird's eye view of and a close up on what is going on in social work and healthcare currently. The article that I included was an article that I wrote for the monograph, and I thought it was a good way to start this course because I really wanted to be very clear. And the point of the article was to show the connection between um, um, medical and mental health. And even though we're talking about two different types of healthcare, they're very, very, very uniquely aligned in that if you are dealing with a mental health challenge, it can very easily turn into a physical health challenge. And if you have a physical health challenge, it can very easily turn into a mental health challenge. I don't know too many people who are dealing with a chronic illness, such as cancer and even asthma, HIV and AIDS, um, where that over time, the care burden, the feeling of being sick, the medication, the doctor's healthcare, thoughts about life, quality of life, interactions with family related to illness. I don't know too many situations in which someone who's dealing with a chronic illness does not oftentimes simultaneously struggle with a mental health condition. That can be depression, anxiety, and a whole host of other type of mental health challenges, usually dealing with severe stress related to the illness, care burdens related to the illness, and so forth. But what I want you to see here is that, the intersect between physical health and mental health. And so oftentimes as social workers, medical social workers, you're doing a lot in terms of mental health assessments as well as physical health assessments. And they're very closely aligned. And so you have to have um, plenty of skills, a lot of skill sets that you're applying in the mental health as well as the medical world. And that is what the article provided a lot of information and evidence showing the strong connection between physical health and mental health. And so, again, that's another example of the dynamic nature of social work, where you're not just you're doing comprehensive biopsychosocial assessments and you're making sure that you understand what's going on with clients. I regularly and routinely did different type of mental health assessments and screens as a medical social worker. And oftentimes I'm working with family members as well as the clients to get them not only to make sure that their physical health needs are met and are in place from a wellness standpoint, but the mental health as well. And so I thought it was a good segue to talk about that. And the monograph is specifically looking at COVID-19 as we are going through a major public health pandemic at this time. It's very important that we understand what's going on in relation to healthcare social work in response to COVID-19. Also, I think something that's very unique that I would like students to pay attention to is that we've had a transition in administration. And it's almost as if the changes in response to COVID-19 will be contrast. It will be very different. And so it'll be very interesting to keep an eye on how COVID-19 has evolved across administrations, um, and how the review and the response, policies, infections, um, outcomes, treatment, so forth, changes under two different administrations. So I strongly encourage students to please keep a very close view on how the pandemic is managed and the outcomes of the pandemic, or the experiences with the pandemic under two administrations. This is a very rich opportunity to really understand how public health um, impacts how we live, how we learn people, but also policy too. As we move along through the course, we'll go more in depth about what social work and healthcare looks like as it relates to more specific health issues. We will be covering ethics and patient rights, maternal child health and genetics. We'll also be covering children with special health needs, adolescent healthcare and pregnancy. We'll also be reviewing practice evaluation, HIV, cancer, are other topics that we'll be covering in this course. We'll also be covering older adults and healthcare related to older adults. We'll also be covering death and dying as well, palliative care, comfort care. We'll also be looking at other types of chronic health conditions, as well as the impact of disease on patient and families. And so we're going to be doing a deep dive in a lot of areas for this course, and you'll be demonstrating your understanding of the key areas that we're covering and the key points in the course through your discussion boards and your assignments. I will be uploading individual videos for the assignments themselves, going over them and covering them in more detail. But just to briefly introduce them, as I've done on the syllabus review, is you will have an interview assignment. It's going to be an ethnographic interview. Well, you will have some resources uploaded in Blackboard to guide you on that, and I will also do a review of the assignment on another video. And in that assignment, you'll be understanding a disease, impacts of disease on a patient through interview and through ethnographic techniques, which is a form of qualitative research technique as well. The second assignment that you'll have will be a comprehensive annotated bibliography. Resources will be provided for that as well. And that is your preparation for your final paper. So that annotative bibliography will be a review of the literature, and that focus on that annotated bibliography as well, and the paper will be COVID-19. And so you will be doing a combing of the literature and summarizing the literature in preparation for your final paper. That same literature that you'll be using, that lit review for the annotated bibliography, will be incorporated into your final health challenge paper. The health challenge paper will be COVID-19 is the identified health challenge for this semester, and you'll be writing a comprehensive paper about that. And so again, that's pretty much the course, what you'll be learning, reading, understanding, and how you'll be demonstrating what you're learning in the course. Very excited about this. I really hope you think about these assignments as not just academic requirement for the school, but also a way to professionally enhance your understanding of current and relevant issues in healthcare. I look forward to being your professor and guiding you on this journey. There is also a video that we're going to probably watch. I just have to figure out how I'm going to grant access for that video with the students. So stay tuned for that. It is a very good video. Most of the students have watched it, talk about it, and I think we'll also probably have a debrief session about the video as well, be available for that. So again, a lot of exciting and interesting things we'll be doing in the course this semester. I look forward to hearing from you all, working with you all, and being available. Starting next week, we will have weekly virtual office hours to answer any questions that you have for the course. Thank you very much, and welcome to the beginning of the semester.